My topic for today's discussion is regarding what are the tips and what are the things which we should keep in mind while measuring the blood pressure of the patient at home. This is very important because a lot of times domiciliary blood pressure recording or measuring of the blood pressure at home is encouraged in a lot of patients. But if at all the patient do not know how to measure the blood pressure and what all things can be important in measuring of the blood pressure and what all small mistakes can make huge amount of difference in the measurement of blood pressure, then likelihood of mistakes being made during the blood pressure recording is very common. And the biggest problem is that people do not realize how small mistakes can make a huge amount of difference in the blood pressure reading, and even a 10 to 15 millimeters recording error in the blood pressure can make a huge amount of significance, because at the end of the day one drug at its full dosage will make a blood pressure difference of 5 to 15 millimeters or 20 millimeters at its max. So if at all instead of a 140 blood pressure you are reporting 160, or instead of 160 you are reporting 140, then you will add up adding or subtracting one extra drug at its full dose, something which you not actually are needing. For example, if you are reporting your blood pressure instead of 140 you are reporting as 160, then doctor will start you one extra medicine at full dose which you actually don't need. Vice versa, if you are reporting at 140 and your actual blood pressure is 160, then one drug which should have been added in your medicine is not being added, and you are unnecessary being forced to stay at a much higher blood pressure, and long-term consequences related to blood pressure will be much higher in your body. So at the end of the day, we need a very accurate blood pressure reading if at all we want to manage the disease in an appropriate way. That is why salient features and small little things which need to be kept in mind we'll be going to be discussing in this topic. This topic is going to be very important and clinically useful, so I would request you to see the video till the end. The people who are new to my channel, I would request you to subscribe to my channel. If at all you have any comments, queries, suggestions, or any patient related topics or any patient related queries, you can write to us about them in the comment section below. The people who are interested in a brief summary of majority of the topics, we are constantly uploading a lot of YouTube shorts where 1 minute brief summary of most of the topics and the gist we are uploading. You can take advantage of these YouTube shorts. Coming back to the topic, basically blood pressure is the pressure which the blood creates when it's passing through the vessels. If at all the pressure of the patient is beyond what is expected for that age or for that person, it is considered to be hypertension. If it is very low, it is considered to be hypotension. Blood pressure is an important parameter which decides the perfusion of the blood and the pressure at which blood enters the vessel. So measuring the blood pressure is very important because studies have shown even small difference in blood pressure and little high also if the blood pressure is as compared to the normal, it can increase the cardiovascular morbidity, mortality and the incidence of having heart attack or stroke and other diseases to a significant extent as compared to a person having a normal blood pressure. Now, what happens that whenever you are measuring the blood pressure, if at all a patient is having a systematic bias, that chances that the operator is making the same mistakes in measurement of the blood pressure over and over again, and the same difference in the blood pressure reading is coming over and over again. This is known as systematic bias. Then there is something known as observer bias. Observer bias means that if at all the doctor is measuring the blood pressure of an obese patient, he'll presume the fact that this patient is hypertensive and he'll report the reading on slightly higher side. And similarly, if the patient is a lean and thin built patient or the patient who is less likely to be hypertensive or a child, he is more likely to report a normal blood pressure as compared to what he would actually do. And this creates an observer bias because our mindset is like that we tend to feel that this person is hypertensive and this should not be. Third is what is known as rounding of error or the tendency to round off the digits. This happens when at all you have a blood pressure of 144 or 146 and you tend to report it as either 140 or 150 because you want to round off the blood pressure to the lowest lowest number containing the 0 digit. For example, 144 you round it as 140, 146 you round it as 150. Similarly, for diastolic you round 94 as 90 and 95, 96 you report it as 100. So this tendency to round off the blood pressure will also create a significant error of 4 to 6 millimeters at any point of time. And secondly, it also creates a sort of negligence and complacence in time at the time while you are measuring the blood pressure, because the accuracy with which you are measuring the blood pressure using a BP measurement device, especially with the mercury based or the sphygmomanometric device, you are much less accurate if at all you are rounding of the disease, because you try to feel approximately 140 it is, approximately 130 it is, something like that. So that also creates an additional error of maybe 4 to 6 millimeters, and at the end when multiple errors are added, the amount of difference which that makes to the blood pressure reading is huge. So all of these biases should also be kept in mind. Usually whenever you are recording the blood pressure, either you can use a sphygmomanometric device or a digital based oscillometric device. If at all you are having a paramedical staff or someone who has been trained in measurement of the blood pressure, it is advisable that you can use a sphygmomanometric device or a mercury based device. But even if at all you are using an oscillometric device or a digital BP recording device, which majority of the people are using at home, that device is relatively good, and since last 10 to 12 years I am using the same device in my clinic. Most often we do not find a significant error, and majority of the times the correlation of the regular blood pressure with the digital blood pressure is almost similar. Usually there has been not many significant issues with the measurement of blood pressure with a digital device. That is why for a practical purpose, when the people are checking their own blood pressure or the relatives blood pressure and have not been trained in measurement of the blood pressure, it is better that they use a digital device, because that gives a nearly accurate blood pressure measurement, and pulse rate is also mentioned on that, so that also helps in making a lot of decisions, and you can accurately chart your blood pressure, nearly accurately chart your blood pressure on the depending on how many times you are measuring your blood pressure. Next important thing is, what are the number of readings which people should make at one point of time. Ideally, measuring your blood pressure 10 times per day should be avoided. You should measure your blood pressure one particular time of the day, maybe once or twice in one day. Do not make 10 measurements, and at one particular time if you are measuring, do not measure your blood pressure 5 to 6 times. Measure it once, then give your arm some time to relax, so that the venous congestion which has occurred in the arm, that the blood goes off, the arm swelling comes down. Then you measure the blood pressure after maybe 2 to 3 minutes, because if at all you are rapidly measuring your blood pressure 3-4 times at one go, there are high chances that the second and third reading will be much higher and much wrong, because at that point of time a lot of blood which is accumulated in the hand, it will not get time to get absorbed, and the reading subsequently will become much higher, or almost always will be incorrect. So better to give your arm a little bit of time. Take 3 readings at one point of time, take an average of 3 readings, and at least give your arm 2 to 3 minutes of time to relax, and before you take the next reading. Usually blood pressure should be measured in a sitting position. Some people who are not ambulatory or not being able to sit, the blood pressure can be measured in a supine or a sleeping position with the arm placed at the laterally at the level of the heart. But majority of the times sitting position is considered to be the best. You should ideally sit on a chair rather than a stool, because the back of the, if at all you are sitting on a chair, the back is supported. Keep your back supported on the backrest of the chair, and your arm should be on a table with the arm in a supine position. This is supine, this is prone position. So arm should be supine and slightly extended the arm should be. You should be sitting in a comfortable position, should not be too much of cringing in the chair. And your back should be adequately supported, because if at all you are your back muscles are being used to keep your back straight and there is no back support, then the chances of the blood pressure getting overestimated by 6 to 10 millimeters is very common. If at all you are sitting on a chair, you should ensure that your foot is exactly placed on the floor. It should not be hanging loosely, because if your foot is hanging and you are sitting on a very tall chair, then the amount of muscle flexing which is required for the foot, that also increases your blood pressure. Your foot should not be crossed. You should not be sitting in a cross leg position, and you should not place one leg over the other, because that can also affect the blood pressure. A very trivial thing, but that can affect your blood pressure. Your arm should be bare. Always keep in mind that the arm in which you are measuring the blood pressure, that should be completely devoid of any clothes. You should not upfold the shirt sleeves or upfold the sweater, because that will create a tourniquet effect, and it will stop the venous congestion of the arm, and that can create a blood pressure difference of 5 to 50 millimeters of mercury. Almost 50 millimeters error might also be created if at all you are having a sweater on the arm which is upfolded, because that will create a complete venous congestion and not allow the blood to flow, and you will not be able to accurately measure the blood pressure. So always remove that sweater or shirt, or use a half sleeve sweater or half sleeve shirt whenever you are measuring your blood pressure. Hand should be extended and hand should be supine, not in a prone position. If at all you are using a sphygmomanometric device, the cuff should be tied to the arm slightly 1 inch above the elbow position. The center of the bladder, which is the inflatable area, should be kept on the artery or just at the center of the arm. Ideally, some BP measurement cuffs also will have a marking for the brachial artery. See that marking and put that marking exactly over the pulse of the brachial artery. So that will give you a much more accurate reading. It should not be going on one side or the other, because that can also create some amount of error. Usually the cuff should not be very tight and it should not be very loose also, because either of them can create a significant error. If at all you are having a BP measurement device, your cloth should not be coming in between that. You should not put the BP cuff over the cloth or the shirt area where you have crumpled your shirt, because that will not allow your BP cuff to be tied in an appropriate way, and that can also create a huge amount of error. If at all you are using a sphygmomanometric measurement technique, or using a stethoscope to measure the blood pressure, you can place the stethoscope just below the BP cuff is tied, and it should be placed snugly. The diaphragm or the area of the stethoscope which has a broader area, which is known as the diaphragm, the smaller area is known as the bell of the stethoscope. Ideally the diaphragm should be placed firmly, should not be pressing on too much, and initially you should use the palpatory method to inflate the cuff to a level where the pulse of the hand or the wrist will disappear, and you go 20 millimeters above that level, and then you come down with your BP measurement. For example, if the pulse is disappearing at 100 millimeters level, then you go to 120, and slowly at the rate of 3 millimeters per second you allow the BP oscillation column to fall down, and then you record the level at which the systolic sounds appear, and then the level at which the systolic sounds disappear, that you have to record. Both these measurements, sounds which are appearing, are known as the Korotkov sounds, and they have to be recorded. The exact level at which they appear and disappear has to be recorded to the closest 2 millimeter level. Ideally the blood pressure cuff inflation and deflation should not be very rapid, because that also can create a huge amount of error in measuring the blood pressure. Now some important small tips which a lot of people tend to forget while measuring the blood pressure. Never keep your bladder full while measuring the blood pressure. You should not be under the strain of the requirement to pass a motion or pass a urine at the point when you are trying to measure your blood pressure, because that strain of having the urge to pass a urine or motion can create a BP measurement error of 10 to 16 millimeters, which is a huge amount of error. Small little thing, but always empty your bladder, pass on your motion, be relaxed. Do not be in an amount of stress whenever you are measuring the blood pressure. Do not be talking whenever you are measuring your blood pressure. Do not be over anxious. If at all you are in some amount of pain, or you are over anxious, or you are thinking about something, or you are having some nausea, vomiting or some symptoms, at that point of time, if you are measuring your blood pressure, the stress hormones in the body will cause the blood pressure to shoot up by 20 to 30 millimeters. So if at all you are measuring your blood pressure, it is always advisable that your body and mind should be completely relaxed, and only then you should measure your blood pressure. You should not have done a huge amount of physical exertion, and you should not have come out after climbing stairs or climbing, walking some amount of distance, and then you immediately measure your blood pressure. Always relax and allow 10 minutes of time for the blood pressure to come back to its normal level, and only then you should measure your blood pressure. Do not talk while measuring the blood pressure. Always measure your blood pressure at the same time of the day. Do not measure it at 10 o'clock in one day and 4 o'clock in the other day and 8 o'clock in the third day, because that time variation will also cause a significant amount of blood pressure mistake. Then the timing of the BP medicine should also be exact whenever you are taking your blood pressure, because sometimes what happens that you are measuring your blood pressure at 10 o'clock, one day you have missed your BP medicine, second day you have taken medicine at 8 o'clock, third day you have taken at 6 o'clock. That time gap with taking of the BP medicine and the dosage at which you are taking the BP medicine, that is also important, because if you have not taken your BP medicine, your BP reading will come high. If you have taken the BP medicine just 1 hour before measuring, your BP will come low. If you are taking 6 to 8 hours the medicine before measuring, for example, you are measuring the BP at 6 o'clock, morning dose you have taken at 8 o'clock, then by that time the BP medicine effect would have dropped down, and you will have a falsely high BP level. So exact timing of the medicine and exact timing of the BP measurement should always be noted, because that also can create a huge amount of difference, and the doctor will falsely believe that your readings are wrong. Avoid having any food before measurement of the blood pressure. Avoid having smoking a cigarette or chewed tobacco just before measurement of the blood pressure is undertaken upon, because tobacco contains a lot of nicotine, and smoking also contains nicotine, which can stimulate a sudden rise of the blood pressure. So smoking should not have been done on the day of measuring the blood pressure. There should not be any pain. For example, if you are in a clinic, an injection prick or something like that, or any trauma to the patient should not have occurred just before you measure the blood pressure, because the pain stimulus will cause the blood pressure to shoot up by 20 to 30 millimeters. Patient should not have done any strenuous work or should not be anxious while measuring the blood pressure. always better to measure the blood pressure at the same point of time, in the same time of the day, and in the same room where the room temperature is also in control. If at all the room temperature is on a very high or a very low side, that also can affect your blood pressure readings. So at the end I will discuss what some small errors, what amount of difference can they make to your blood pressure readings. For example, a person who is sitting without his back supported, the error can be 6 to 10 millimeters. If at all the bladder is full before measurement of the blood pressure, the error can be almost 15 millimeters. If at all you have taken tobacco or caffeine just before measuring the blood pressure, 6 to 11 millimeters error can occur. If at all your arm is not properly placed, if it is unsupported, 1 to 7 millimeters error can occur. If your elbow is too high, 5 millimeters increase of blood pressure will be seen, and if it is too low, the BP reading will be falsely very low. If at all you are having any stress or anxiety, that will create a white coat effect which can increase the blood pressure by 11 to 28 millimeters. Talking or hand gestures can increase the blood pressure by 7 millimeters. Cuff too narrow or very small can increase the blood pressure by 8 to 10 millimeters. Very large BP measurement cuff, for example, if you are using an adult cuff on a child or a child cuff on an adult, that can also create an error. A very large cuff can cause a falsely low blood pressure. If the cuff is not centered on the artery and is lying on one side or the other side, then the error will be 4 millimeters. And most of it all, if the clothing is there on the arm and you have just tucked over the clothing and you are measuring the blood pressure over that, that can create a huge error ranging from 5 to 50 millimeters, which is a huge amount of error. And you can imagine, if at all multiple errors have been committed at the same point of time, the amount of total error can be almost 30 to 50 millimeters, and that will change your entire hypertension management. If you all tell your BP is 130 or 120 or reporting it as 180 or 190, then the entire strategy of blood pressure management will go haywire, and the doctor will end up prescribing you 4 to 5 medicines which you actually don't need. And you will have a lot of side effects pertaining to these medicines also, because your actual blood pressure is much lower or much higher as compared to what you have reported, and the BP medicines will continue to have side effects. For example, your blood pressure will go very low if at all your actual blood pressure is 120 and you reported it as 180, and the doctor prescribes you medicines based on the 180 blood pressure readings. So accurate blood pressure reading is extremely important, and if at all you have made a huge amount of mistake in that, there are high chances that the doctor management strategy will go completely wrong. All these things should also be kept in mind even when the blood pressure is measured in the clinics, because sometimes even the clinic doctors also and the paramedical staff which take the blood pressure in the clinics, that they also might not be adequately trained, and the blood pressure readings which they are also taking might be completely fallacious. So you should keep in mind which are the clinics where the blood pressure is being measured accurately, and you can do a comparative analysis also. So in this topic we have discussed what are the common things which affect the blood pressure readings and should be kept in mind while we are measuring the blood pressure. If at all you have any comments, queries or suggestions pertaining to this topic, you can feel free to discuss about them in the comment section below. If at all you are interested in only a brief summary of the topics, you can refer to the YouTube shorts which we are uploading on a constant basis on our channel, and you can get a brief summary in 1 minute of all the salient features of the topics. The people who are new to my channel, I would request you to subscribe to my channel, as this would give us a lot of inspiration and motivation to continue the channel in future. Thank you.